Mr. Jones. I'm Kelly. I'm going to be your PT today, and I'm just going to talk to you first about some questions about the wound on the bottom of your foot. So, do you know when this wound happened, or was there any trauma involved?
There wasn't any trauma, no.
Okay. Do you take any insulin or metformin to help control your diabetes, and do you take these medications every day and on time?
I have the medications, I don't always take them.
Okay. Good to know. So, do you have any history of peripheral vascular disease or any neuropathies?
Yes, I do.
Okay. And is there any pain with this wound?
No.
No? Okay. Do you ever walk barefoot through your apartment?
Yeah, every day.
Every day? Okay. Do you ever check the insides of your shoes at all to see if there's any objects inside before you put them on?
Sometimes.
Sometimes? Okay. And can you possibly take me through what you eat during a normal day?
Yeah, so for breakfast, I usually have a bagel with cream cheese and some bacon on the side.
Okay.
For lunch, some days I'll eat like a medium-sized pizza to myself, or some days I'll have a sandwich with some chips. For dinner, I love my meatballs, so I usually have a meatball sub with some chips or like fries or something.
Okay. And now I'm just going to talk to you about some aspects of the way that you live a little bit, just to give you an idea of why your wound isn't healing so well.
Okay.
So I see that you have type 2 diabetes. So this impacts the blood vessels that go through your body and your foot, and it makes them smaller, so not enough nutrients are able to get to that wound and able to heal it up. And it also impacts all phases of wound healing, so it inhibits the necessary cells that is needed to heal this wound. And I also see that your A1C is a little bit high, and your blood sugar is pretty high as well, so this gives me a little bit of an indication that you aren't taking care of your diabetes too well, which is something we can definitely work on together. And I also see that you are a current smoker, and this can also impact your wound healing because it causes those blood vessels to constrict, and again, not enough oxygen and nutrients are getting to that wound to be able to heal. And I see you're taking metformin and insulin to control your diabetes. So the metformin can have a positive impact on your wound healing since it helps control these blood sugar levels that you have and helps your body respond better to the insulin that you're also taking. And the metformin also does not cause any weight gain like other medications do, which is also very positive for this wound healing. And the insulin that you take also has a positive impact on wound healing because it's vital for your body to have in order to keep those blood glucose levels in safe ranges. And I see you work as a technician, and this requires a lot of sitting during the day, yes?
Yeah.
Okay. And this can impact the circulation to your legs and lead to a little bit of inadequate blood flow getting to the wound at the bottom of your foot. And do you regularly exercise during the day?
No, not really.
No? Okay. So this can also have a negative impact on your wound healing because you're being very sedentary throughout the day, and exercise can help your heart and make your circulation perform a little bit better. And I see you only drink 1 or 2 alcoholic beverages on the weekends, which is okay. This won't negatively impact your wound healing, but just make sure you don't increase your consumption at all.
A couple of beers here and there.
Just a couple here and there, I understand that, because it can prolong healing times if you drink too much. Okay, and on to the systems review now. And for the cardiovascular system, I would check his vitals such as blood pressure, heart rate, pulses for the dorsalis pedis and posterior tibialis pulses, and I would also check his ABI. And I would also perform a capillary refill to assess his blood flow since he has some pretty pale gray tissue in the wound on his foot. And for pulmonary, I would also check respiratory rate, which is normal for him. And for musculoskeletal, I would check range of motion, strength, anchor reflexes, and do a gait analysis to see how the wound affects his walking, which are all normal for him as well. For neuromuscular, I would check sensation in his feet with the 10-gram monofilament first, initially to test for protective sensation, and test each location 3 times. For gastrointestinal system, I would perform an M&A or MUST questionnaire to check his daily diet, and like I did before, ask him to go through his normal daily diet. And his urogenital system is perfectly fine. It does not seem to have any issues since his medical record seems to not have anything for that. Okay, so now I'm going to perform a sensory test just to see if you can feel anything on the bottom of his foot, to make sure if he ever steps on anything again that he can feel any pain or trauma that may occur. So coming on down to the foot, let me know if you feel anything, okay? Every
Okay.
time I poke.
I can kind of feel that.
Okay.
I can feel that one.
Okay. Okay, and then keep your eyes closed as well.
I can feel that.
Okay. Okay, so now I'm going to perform a capillary refill test to check the blood flow coming to his foot and make sure there's adequate blood flow for the wound to heal. Okay, so I'm just going to come to the nail bed, hold it until the blood leaves, and then watch the amount of time that it takes for the blood to come back. And a normal time would be under 2 seconds, and it would give an indication of microvascular disease if it took more than 3 seconds. And for the sensory exam as well, it gives me a good indication that he can't feel pain or any sensory information much to the bottom of his foot. So a normal would be feeling all of the tests that I would give on the bottom of the foot, but then an abnormal test is, like we just saw, unable to feel sensory information more than 4 times. Action. Okay, so now I'm going to do a wound exam just to see how it's looking and how it's healing. So the wound is located on the bottom of his right foot, and I'm going to measure it. And the length is about 1.5, 1.6 centimeters. The width is about 1.2 centimeters. So that would give me a total of 1.8 centimeters squared. And the wound bed appears to be about 25% red granulation tissue around here. And the rest is 75% pale gray granulation tissue around the red. And it appears to be hypogranular as well. And there could be some possible tunneling around 7 o'clock, but it is hard to tell from this angle of the picture looking down. And the wound edges appear to be macerated around the wound as well. And the wound edges are also rolled or epibally. And the peri wound is calloused almost fully around the wound as well, from 7 o'clock to about 5 o'clock. And then it turns into more macerated tissue around the outside of the foot around 3 o'clock to 9 o'clock. And the larger part of the callus is seen from about 11 o'clock to 3 o'clock as well. And if you look at the rest of the foot, it seems to be more dry and cracked in places such as the toes. And this wound also has a minimal amount of serosanguinous exudate. Okay, so for wound diagnosis, this is a neuropathic or diabetic wound with a Wagner grade of 2. And I would use sharp selective wound debridement, and it would be appropriate in order to pare the calluses down to the epithelial surface. And we could also use some post lavage to clean the wound bed and debride the pale necrotic tissue that's around the red granulation tissue. And it is also able to cleanse the tunneling if that is what is there at 7 o'clock as well. And when covering the wound, I would choose a hydrocolloid dressing, and it would work well with this wound because it only has minimal exudate, and the hydrocolloids are effective in protecting the peri-wound skin from maceration, but still maintaining a moist environment for healing. And they are also self-adherent. And a bit of gauze to pack the wound would also be beneficial since this wound is hypogranular. For educational strategies to the patient, I would say definitely try your best to quit smoking again, since I know you quit the first time. And it would definitely be beneficial to your health and the healing of the wound. And I can also help you get in contact with a therapist or anything like that if you'd like any support while going through the process of quitting again. I'd like you to also check your feet daily for any wounds or things that you might step on multiple times each day. And I'd also like you to start checking your blood sugar more regularly throughout the day and try to maintain a bit of a healthier diet as well. And I can also refer you to a dietitian if you'd like any help coming up with a new diet or ideas of what to include or take out of your daily intake. And when you work during the day, I know you sit a lot, so try to get up about every half hour, stretch a little bit, move around for a couple minutes, improve the circulation going to your legs. That'll help you heal. And I would also like you to start exercising a bit more regularly. You can start off as simple as just going for bike rides or using an elliptical at the gym to increase your heart rate a little bit, get things moving. And long-term challenges after the wound has healed can definitely include maintaining proper blood flow and nutrients to the area, especially if the patient does continue to smoke and remains in a sedentary lifestyle. Adherence in self-management of diabetes can be a challenge for most patients because you don't have necessary knowledge of the wounds, and he doesn't have much family or support around him to keep him to his management. Being compliant with his medications and taking them with fail each day and on time can also be a challenge. Repetitive stresses on the closed wound area could possibly reopen it as well. Neuropathy will be challenging because the patient will not be able to feel any further trauma that occurs to the foot, and it can result in further ulcerations at points of shear and pressure at the foot as well. Maintaining a normal gait can be a challenge as well because patients will often buy smaller shoes or tie them too tight, as well as develop gait abnormalities like a wider stance or harder heel strike or toe gripping to increase their ground perception as well.